Hi, my name's Adam. I'm a physical therapist here at Health Emotion in Merrill, and today's discussion is going to be on imaging such as x-rays or MRIs, and we're going to focus mostly on imaging for the low back, but a lot of these concepts can translate to other areas of the body too. So as a quick disclaimer, imaging certainly has its role, certainly has its place. There are definite conditions where it would be warranted. However, we are using it way too much. So since the 90s, there's been a dramatic increase in the amount of imaging that we're doing, and these images are getting super high definition too, just like everything else. So we're really finding anything and everything that's, quote unquote wrong and diagnosing that. And this is leading to excessive costs for patients, it's leading to overdiagnosis, and it's actually worsening outcomes too. So when people get imaging done, what are they trying to find out? Well, obviously, what's causing their pain, right? But that's where a bit of a problem arises because a lot of people can show those same changes on imaging but have no pain. For example, a condition that we see a ton diagnosed is going to be degenerating discs. And they did a study not too long ago that looked at people that had no back pain and found that, by the time you hit 50, 80+% of people are going to show degenerating discs. So that makes it very hard to say a condition like that is, causing someone's pain when so many people have that exact same condition with no pain. So on these images, unless they find something, scary on there or concerning on there, a lot of these changes, like, degenerated discs or disc bulges or even some arthritis in there, these are just normal age-related changes, just happens with life. I mean, we sometimes refer to these things as, the gray hair of the spine or the wrinkles of the spine. So rather than being something concerning, it's just what happens as we age. And again, does not need to be something that causes pain because so many people have those same conditions with no pain. After someone has an injury, they find that if they go ahead and get some imaging done right away, they spend more money and they have worse outcomes than people that, kind of wait it out or maybe get some conservative treatment with that. So again, it's not something that we need to necessarily do unless there are, signs that we really need it, which we could help you out with. Same thing goes for someone that's had pain for a while. Let's say they were diagnosed with some arthritis before, and they don't have any hope that things can get better because they have arthritis. Well, again, something like that too. A lot of people that have no pain have arthritis too. So it doesn't need to be something that they're just going to have to live with for the rest of their life just because of what imaging told them. So again, imaging, the main takeaways, imaging has its place. There are times where we do need it, but for the most part, it's being used way too much. We don't need to use it as much as we have been, and don't feel like you need to go in there for imaging for any sort of ache and pain. So you're going to save some money, and hopefully it improves your outcomes too. So thank you guys for watching, and have yourselves a good day.